This is Max. Max is 6 months old, and he's trying baby-led weaning for one of the first times. Max is having a banana here, and notice we left part of the peel on so he has something less slimy to grab onto. Also notice that Max's mom didn't put the food in his mouth, but let him bring it to his mouth instead. Max just took a big bite. When your baby takes a big bite, you just want to watch them closely to see what happens. He may choose to spit it out, or he may try to swallow it. If he tries to swallow it, he might start to gag a little bit, but that's totally normal. As you can see, he's trying to figure out what to do with it. He may choose to swallow it, and he may choose to spit it right back out. Now, as he tries to swallow it, he might start to gag a little bit, and that's totally safe and normal. Just make sure that you're monitoring closely so that if he does start to choke, you can help him out. Babies have a very sensitive gag reflex, and it's forward in their mouth instead of at the back of their throat. So oftentimes they'll gag frequently when you're giving them solid foods. Now you'll see Max starts to gag a little bit. His eyes start to water, but you can tell he's still having fun. As long as you can hear him making gag sounds, you know that he's working through it and that he's going to be just fine. Here comes a big gag. You can still hear him working through it. He's just trying to decide if he should swallow or spit it out. Max decided to spit it out. And look at that, he's excited to go back for more. So while it may be really scary to watch as a parent, clearly Max is having a great time eating solid foods and can take care of himself to get the food out if he needs to. Now Max is eating an avocado wedge. You can see that we rolled it in infant cereal, so it's a little bit less slimy and easier for him to grip. Make sure you let your baby do what they want with the food. It doesn't have to go directly in his mouth. He may choose to just play and explore with it, squish it in his hands, throw it on the floor, and that's just fine. Remember, things can get messy. Make sure you have a few pieces on hand, so if a few of them make it on the floor, there's still an opportunity to get some in his mouth. Notice too that Max is super happy and calm. You never want to feed a baby when they're upset. Once he gets a little in his mouth, you want to just watch what happens. He'll keep playing with it and squishing it, but his mouth will be working on either gagging and spitting it out or swallowing it. Remember, you always want to watch your child closely. This isn't the time to turn around and do the dishes. Just keep an eye on him so that you can watch to see if he's having that gag reaction. That was a big bite for Max. You can see he's thinking about what he should do with that big bite. I think he likes it. He's still working on this piece of avocado. You can see he's starting to gag a little bit. His eyes start to water, but he's making sounds, and you can tell that his mouth is working on getting that food out if it needs to. Again, you'll notice Max was totally calm and happy this whole time. So as a parent, it's really important that even if it's scary to watch, you stay calm and happy too, so you don't scare your child. You also want to make sure that unless your child is truly choking, you're not smacking them on the back or putting a hand in their mouth, as that can actually help them choke more. Now Max is trying corn on the cob for the first time. You'll notice that we removed all the kernels because we don't want him actually eating pieces of food that are so small. This is more just to have him suck on this corn cob, get to know the flavor of it, and practice holding food and bringing it to his mouth. Food like this can actually be a great teething toy too. You'll see he likes to gnaw on it and massage it against his gums. Just a reminder that we recommend you take an infant CPR and first aid certification course so that you're ready in case anything happens while you're introducing solid foods. You can also always learn more on Tinyhood with our infant choking and CPR class as well. Keep in mind that it's totally fine and normal. It's never too early to help your baby develop a healthy relationship with food. Let's get started.